Introduce yourself.
And for you guys that don't know me, my name is Tyson, and I'm a massage therapist here. I'm also a certified fitness trainer, so that's why I know a little bit about this stuff. I got certified 2 years ago, and I've been doing a lot more massage than I have personal training, but it still helps to know a lot about it. So, what I'm going to talk about today is a little bit how to take care of your body in the form of foam rolling. There's a lot of different ways you can take care of your body. One of the most important things that you can do as a therapist is to get myofascial release work yourself. So this is a form of myofascial release that you can kind of easily take care of your body. It's really cheap. These foam rollers range from the little ones, the short little ones for $15 to these bigger ones for like $20 or $35. So it's really not that expensive. And the whole point of it is to get the muscles loosened up, and so you can better stretch, you can better relax your muscles, and you have greater range of motion when doing this. And I found a huge increase in my my mobility, my flexibility when I'm doing this more often than when I'm not. When you're working a lot more, it's very important that you get massage therapy, and if you're not getting massage, then definitely do the foam roll. If you're not doing either of these, you're just hurting your body. So I think it's best physically to get massage at least once a month, at least from someone that you know, or going out and getting a massage, and then in between doing the foam roller to create more flexibility in the body and more mobility in the body. Now, I'm going to be, I'm not going to be naked, but I'm going to take off my shirt, and I have just skin tight so you can see exactly what I'm doing. You can see what muscles I'm working on. I have bike shorts, same thing, so you can see exactly what muscles I'm working on. And that way we can kind of go through this, and in case you guys have any questions at the end, you can go ahead and ask me about any specific areas you want me to focus on. Or I've been doing foam rolling for like 5 years now, ever since I've been doing massage therapy. I learned from one of my teachers it's a great way, like I said, just to keep in shape, to keep your body fit. So let's go right into it. This is my foam roller. This is the black ones are very hard. It's unforgiving, so at times it can be very, very, very painful. So some other foam rollers, the one I started with was this foam roller 5 years ago, and as you can tell, it's gone down quite a bit. So
anybody else?
It's not as this foam roller doesn't do as well anymore, because literally I could like bend this in half, and it's not very effective anymore. The reason I keep it is because there's some days that I'm just so sore from working out or from working that I can't use the black one. So I have a white one, a medium softness, which is this blue one right here. It's not as soft as the white one. And thank you, Sherry, for bringing this in, wherever you are. Okay. So she brought this one in, and this is a medium softness. So if you use this one, it's going to be really good if you're starting off. So the black one is great, but like I said, it's very hard, and it's going to be the hardest model you can buy. Come talk to me afterwards if you want to know where to buy them and all that stuff. So the basic body parts, I'm going to work throughout the whole body, and basically start from the glutes, go to the legs, work everything from the upper body to your neck. So that way you can kind of see how I do it at home. It takes about 30 minutes to get through the whole body. So if specifically you want to work on certain areas, then it's okay to focus on just those areas when you need them. I don't go through the whole body every day. It would just take, like I said, 30 minutes. I don't always have 30 minutes. So you start off by just sitting, and you work the glutes. I'm going to show you a basic and an advanced way for most of these. The basic version for this is just to keep your legs straight and just to roll back and forth over the glute muscle. Now, I don't really feel this. And the reason that is probably because I've been doing this a while. So for me, this doesn't do anything. I don't really get a huge benefit from this. So then what I do, this is the basic, is just to keep your legs straight and just to roll back and forth. You can go to one side to try to affect that left side, and then if you move over to the right, obviously, you're working out the right side. So then what I do to create it more, to get more an advanced feel, to get deeper into the muscle, I cross my leg over like so, and this helps me penetrate the muscle deeper. So when I do this, I feel it greater, and I can kind of shift my body over to the left and work out more of the medius, the outside glute, and it allows me to work like the piriformis, base of the hamstrings, basically everything that ties into my lower glute area. And I go all the way pretty much to the top of the iliac crest, and then roll down. Thank you, Selena. Yelling out here. Okay. So I feel that pretty good. All right. So we're gonna go straight into the next muscle group. So then I work the IT band, which is not a muscle. Once again, the IT band is a fascia. So it's a band of tissue, and basically it runs from the TFL right about here and rolls all the way down and attaches to the left side of the knee. So anytime you're working this area, it's good to start off really basic, and the basic way to start off is to actually bend your knee. So when I work over the IT band, I'm bending my knee because it's very painful if you work on it with a straight leg. So you just kind of put your pressure, and there's two ways to roll. Now, you can either roll back and forth like I'm doing, or you can find an area that feels very tight and just stay there for 30 seconds. So what I mean by that is I'll be rolling, and then I feel a restriction, and then I just hold it for 30 seconds and just rest on it. Basically, kind of like when your elbows are in a client and you can feel that they're resisting or that it needs to be released. You can just stay over that area for 30 seconds, and then once you feel kind of a release or a let go, then you can continue rolling. And the reason that's good is because you can start to systematically get rid of the knots in your legs and in your body. Okay? So I roll the IT band all the way down to my knee with a bent leg. Now once again, this is the basic form. Okay? Now if you want to do a more advanced form, then you straighten your leg. You can still keep your foot here for stability and balance, but most of the time I put my leg straight and then roll that out. This is unbelievably painful. But it's worth it.
In a good way.
Yeah, it's worth it, and you'll actually free up a lot of your knots. Like today, I'm very tight, so I'm going to put my foot here just for added stability and support. And what you're doing out here with your arms is you're just stabilizing. So whatever feels comfortable for you. Some people like to go on their elbows, and you're just rolling back and forth. Okay? Now, I'm getting the lateral portion, the posterior portion, so the back of my legs, the side of my IT band, and then all the way up to the front. And then when I switch over and I start to do the quads, it's an easy transformation. So when you're doing the quadriceps, you want to focus, you want to start basically where the pelvic bone is, and you want to roll down to the top of the knees. Now when I get closer to the knees, I feel more tension. So you want to go slower as you get closer to the attachment site. So as I'm moving downwards, I feel it starting to get harder, and so I start to slow down closer when I get to the knees. So once again, you start at the pelvic bone, on your elbows. I like to start on my elbows for this one, and move forward. And then I just crawl out. And make sure you're breathing throughout the process. And then as I get here, I kind of raise up my hands, and then just stand, and then come back. And once again, this is a basic form. For more advanced, you're doing one leg at a time. And now with these bigger foam rollers, it's a little bit harder. But when you have a little tiny roller, about 1.5 feet, you can do this easier. And what I do is I place it all the way to the side so I can just do one leg at a time. So I'm going to do the left quad right now. So I place it to the side. This leg is free so it can glide along without having the foam roller restriction. So it's really more intense because I'm putting more weight on top of that left quadricep. And then just to make it a little bit more dynamic, you can bend your knee and work that quadricep a little bit more. And you can do the inner medial portion of it. So I'm turning my leg like this. I'm externally rotating to get actually the outer portion. And to internally rotate, I'm going to get start to get the adductors. But not quite, because you have to do something else to get the adductors. So once I've rolled out my quads, they feel good, they feel loose. Then I'm going to turn my foam roller sideways like this. And I'm going to do the adductors. And the way you do the adductor is you have to kind of lie on it vertically. So I'm going to kind of come to it with my chest and my head and my spine aligned to the foam roller. And then I'm going to place the foam roller on the inside of my thigh with my knee bent. And then I'm going to roll to my left and leave that leg. I'm going to extend it a little bit just to roll. Now, there's no really advanced or basic form of this. This is just what it is. It's a pretty advanced roll. And if you want to make it less intense, just put more pressure on your arms rather than putting pressure here. Put more pressure on your arms. And this I feel a lot. And you can also kind of lay down like I'm doing. I'm putting all my weight on the ground and I'm just propping my leg up on the foam roll and just rolling it back and forth. This is a lot less intense. But if I want to get more of a deeper tissue push, then I get up and I put most of my weight on that leg. Now when you're in this position, you can also work the psoas muscle, which is very important for us therapists. The psoas muscle connects to the 5 vertebrae in the back all the way up to the front. And so the way you work that is a little bit more difficult. And you have to kind of put the foam roller diagonally and lay all your weight and basically put the foam roller right here. It's on the inside of your thigh, okay? And what you have to do is when you put the foam roller on the inside of your thigh, you have to bend your knee to a point where you start to feel that pull, that deep pull. And right there, I've got the psoas muscle. I can only explain to you how to do it. It's really hard to show you because it feels like you should be on your adductors, but you're really on your psoas because you're on the inside of that iliac crest. The anterior superior iliac spine, that top portion, that top bump on your iliac, that's where you need to be on the inside of that spine, because on the inside you have the iliacus and the psoas muscle that runs through that groove. So the only way you can affect that muscle is by being in that groove. And so that's in between basically your groin and the inside of your leg. So it's a really hard muscle to reach, but it really has a lot of benefits if you can reach it. And what I do, this is where I start to add a little bit of dynamic movement. When you're doing a foam roller, you can either do it without any movement, or you can add a little bit of movement in it to get more of a dynamic feel to it and open up those muscles a little bit greater. So what I do for the psoas is I find that psoas muscle, I find it, and then I lift up my knee like this. And then I place it back down and straighten it out. And I'm kind of twisting my leg at the same time that I'm doing this. It opens it up and I can feel a really nice, this one is not painful. It's not as painful as the IT band. And I'm getting a really good stretch for my psoas muscle. Okay. Now, the next group of muscles that we're going to do are the lower legs. And let me get rid of this. The way I do that is this one I made up. It's kind of cool. You lay down, put the back of your knees on the foam roller, and just lay down and do what I call windshield wipers. Where you just move your legs back and forth like this. Your toes are doing this, and that's enough for me. I don't need to do any more advanced version. I just move my leg down a little bit and go back and forth like this. And I keep on going down all the way the gastroc. And you're affecting the soleus, and you're affecting the Achilles as you get closer to the ankle. I can feel it more on my right side. It's kind of like it has more restriction. So I might want to find an area and then put my other leg on top to give it a little bit more pressure and just sit there for 30 seconds. Okay? And then as I go further down, you can plantar flex the feet, point them forward, and roll them out. Okay? So this gets the middle and lower calf really good. If you do it with dorsiflexion, you're not going to feel it as much. I don't feel that at all. It doesn't feel like a stretch for me, so I have to flex the toes. Okay. So I feel this, and what I'm going to do is I'm going to turn my feet medially. I'm going to turn my feet inside like this. And then I'm going to go external rotation to get the lateral portion of the calf. Alright, one group that I skipped was the hamstrings, so I'm going to do that. So you start where you ended with the glutes, okay, and keep your feet straight and move back. And just roll back onto your hamstrings. Now, I don't feel this, so once again, I have to make it more advanced for me. Because once you stop feeling it, there's really you're not doing anything other than just getting a little bit of blood to move. You're not really opening up any pathways. So what I do is I'll reach forward with one arm. Now I feel this. So as I'm reaching, I'm stretching my hamstrings. And it's creating more tension and more tightness. So I'm able to loosen up my hamstrings a little bit more. And once again, if you're still not feeling this, then move the foam roller to the side in order to affect the hamstring by itself. And reach. And grab. This is my favorite way to work the hamstrings. Make sure you're breathing throughout the entire session. I'm not breathing very good because I'm trying to talk, but you have to breathe. It's really, really important. And if you find an area, once again, just hold it for 30 seconds. I'm not going to hold it for 30 seconds because I don't have that time, but we're trying to get through the whole body, so. Okay, so there's the legs. From the glutes, to the quads, to the adductors, to the IT band, the calves, the soleus, you can get kind of indirectly. You can't really focus on it because in order to work the soleus, it requires the knee to be flexed, so you can work in there, and it's harder to do that on this. Now we're going to work the anterior shin, and the way you do that is you just go into this position and just work like this. One at a time if you want, to get a little bit more pressure. I don't know why you want to do that, but you don't need to. Plenty deep. And you can work all the way down to the ankle area. Okay. So that's the lower legs. Now I'm going to go into the back. The back's really important, and I think it's everyone wants to know how to do the back. So you start on the lumbar back. Now I have to say, if there's anyone that has any like disc problems or disc herniations, you should be really careful with the lumbar spine as well as the cervical spine, as well as I'm sure most of you know that. I wouldn't put too much pressure on your lumbar spine if you have any problems with it. It's just that simple, you know. Luckily, knock on wood, I don't have any of those things. So I'm going to put some pressure on my low back. But if you have anything like that, I wouldn't put any pressure on your low back like this. You know, I just wouldn't do this. So what I'm doing is I'm working down the spine from the sacrum, or up the spine, starting at the top of the sacrum, about S1, and I'm working out about to T12. Okay, and now to get more of the quadratus lumborum, I'm going to go to the side, like this. Okay, you gotta be careful of that 14th rib, or 12th rib. You don't want it to be poking, so you just go till you feel comfortable. And I'm indirectly working the top of the glutes as well. So I'm going to the side more, working more of that QL. Okay. I'm not completely sidelined. I'm about halfway in between. Okay. After you do the lumbar spine, those are the two areas, pretty much simple how I like to do it. Now you do the thoracic, starting from about T12, work up all the way to C7. And I like to keep my arms above me and sometimes over my head, because you're opening up the scapula and creating more extension throughout your thoracic cavity. So this feels really good for the scapula and the rhomboids if you open up your arms like this. And this is something that I started doing, would be to add a little bit more dynamic. You move from side to side like this. And this feels really good, especially if you have some tightness in your scapula. You can find that and just kind of stretch it out to the side. I get a lot of pops this way. And it feels really good to me. Not painful at all, just really good. You can roll all the way to the rotators, the rotator cuff muscles, supraspinatus, infraspinatus, teres minor. Okay, and you can work those out by just leaning on them and putting pressure for about 30 seconds. Okay, then I work into the cervical area. While on my back, I go onto my toes and I put a little bit of pressure here. Once again, if you have any sort of neck problems, any disc herniations, any like serious disc problems, don't do this portion onto your neck. Get someone else to work it out or use something smaller. I keep my arms up above just to give a little bit of support, because if it's here, it doesn't feel right. So I put my arms above my head just to give a little bit of support. Okay, and then you can work the lats by going onto your left side and extending your arm out in front of you and reaching. You can work the lats, the serratus, by turning over a little bit more. You can work like the front here, partly into the pec minor. I'm working the pec minor right now. It's very painful. And I'm just leaning. I'm not doing any rolling here. You don't have to do any rolling. You just lean and kind of put pressure. I found an area. Normally I'd spend 30 seconds on that area. Okay. So, work all of that. You can then bend your arm instead of having it above like I've had the whole time. Now you can have it underneath. And I'm working the back of the shoulder, the posterior deltoid, triceps a little bit. To do more of the triceps, then you extend your arm out like this, above you. And now I'm straightening my arm so I can work the triceps. I'll go all the way down. So I can work that really well. My triceps are very sore. If you want to make this easier, you can do both. Less pressure. And you just lift up your thoracic spine and move out. You can move out the foam roller and just sit. And just do little movements. Move out the foam roller a little bit more. Go about your mid tricep and just put pressure. And do a little bit of rolling by lifting up your back, by arching your back. Go further. Closer to the elbow, it gets more painful. So once again, just lifting and rolling.
Do you feel that in your lower back at all?
No. But if you have any disc problems, it probably wouldn't do this. I hope no one has any disc problems. So then, you want to work the front of the body. Now that I've gotten the back pretty good. Oh, I forgot to mention. So this is one way to work on it horizontally. Another way you can work on it is vertically. And this is really good to open up each side of the paraspinals of the spine. Also to help you get a little bit more movement in that scapula. And the way I do that is I lay back. A lot of people just like laying on it like this. I don't really like it. It doesn't feel good to me. If I just like lay down like this, for some reason, I don't know. A lot of people like doing that, but I don't prefer it. So I'm rolling. It's on the middle of my spine, and I'm rolling just off of my spine to the left. And then I'm gonna find an area, and I'm gonna do shoulder circles. Okay. Not enough pressure. So what I do is I lift up my back, or I lift up my legs to put more pressure and move out my shoulders. See, I can feel that a lot better. So what I'm doing is I'm lifting my hips off the ground to provide more pressure in my shoulder. Go the other side. Once again, just do normal arm circles. If you don't feel that, lift up your hips. And I feel that a lot better. Okay. Now, in order to work more of the neck, what I like to do is put it horizontally again. Now I'm going to be working the levator scapula as well as the traps, the top portion of the traps, and the scalenes. And so you do one side at a time, shoulder underneath or below it. And right now, I'm going to be leaning back more to work the levator scapula. Now, sometimes I don't feel this. It's like lock solid. So what I do is I lift up my hips. And this looks really weird, I'm sure, but it's very effective. It's probably the best foam roller technique I use. My favorite. I feel a headache. But then when I release, it lets go. And I feel a release in my body. So from the back, it looks okay. Okay. Now, to work the chest, I usually just put my arms out like this, kind of roll it out, and then I do a stretch. So I put my hand down on this side and go towards the opposite side. See how my feet are kind of like this? Instead of keeping them straight, so they don't have any torque. I separate them, create a little bit more torque. So once again, put my arm straight on the other side, on the left side. Place your hand here, create that torque, and stretch. Now you're stretching the pec major, you're stretching the anterior deltoid. And then you can switch it to work more of the pec. Do vertical, keep your arm out, and just work out from the collarbone all the way to the anterior shoulder. So you're working basically from your sternum outwards, up to your collarbone. I like to keep my arm here, and if you want a little bit more dynamic, move your arm. This is another really, really important one for you therapists, us therapists. I forget, I'm a therapist sometimes. Ow. Obviously I'm a therapist, because I can feel it a lot here. Okay? Don't ignore this one. Another really, really important one. Okay? So you just kind of extend that arm out, and you're moving it. Once you get to a comfortable position, you're moving it. And I'm moving it like this, up, underneath, bring my arm up, just doing like all kinds of hand movements to get more of that muscle. How much time do I have? Do you know what time I'm at?
It's 8:40 now.
Okay. That's pretty much it. The whole body. I brought some other things. We started kind of late because we were moving chairs. I brought some other things that I use. I use a medicine ball for my glutes. I use a lacrosse ball for like my occipitals, because it is limited. There's some things that you can't do with it. You can't get like the fine little muscles. So I use the lacrosse ball for like my scapula. I place it here when I'm laying down and do like arm circles. I lay down and use it for my occipitals. Okay, so I just place it here, and then I just move my head around to try to loosen up that occipital ridge. Very important area. And I'll just stay on an area that's really tight for 30 seconds, and I'll just relax. And that to me is the way I could get my neck a little bit deeper. The PVC pipe is used if you want extreme pain. And I've only used it a couple times, but it's really, you'll get to a point where the foam roller's not going to do anything for you, because you're to that point, your body's so developed. So you can use a PVC pipe, or even this wooden dowel for like your glutes, your occipital ridge. You can do your forearms with this. It's a really good idea to do your forearms. A little bit harder to do the forearms on the foam roller. A lot of times what I'll do is I'll just lay it flat and then do it like this. Just kind of put my weight and do the back of my forearms. And I'll twist it and basically do it that way. All right, thank you.